Hi, Dr. Sasse here from Sasse Surgical in Reno, Nevada. Had an important question put to me today by a patient that I have known for a number of years, and he said, how do I know if I should have my older bariatric surgery revised? How do I know if I should have my past sleeve gastrectomy or my past gastric bypass revised to something newer and better or improved? And it helped me think a little bit about when we make that decision and how you should think about that decision if it is something that's on your mind. So if you hang in there till the end of this video, I'm going to give you 3 steps that you can take now to answer that question for you and ways to act upon it. But first let me just say that the answer I gave to him was, well, I think the ways to think about it are really sort of 3 categories. One is just simply about body weight. So, is your body weight where it needs to be? Are you in a healthy place? And that goes back to the criteria that we think about for treating excess weight or obesity. So we usually use BMI or body mass index as a guide for kind of determining what kind of health category we're in. If the body mass index or BMI is over 30, then for many decades the health authorities have considered that obesity. And anything beyond that, certainly over 35, you get the terms morbid obesity or excessive obesity, severe obesity, etc. But I would say anyone whose BMI is still over 30, it's at least worth thinking about, and it's at least worth a conversation as to whether revising the past bariatric surgery might be a good idea. Certainly if the BMI is 35 or greater, then I think it's definitely worth a conversation, and it's a strong consideration that the past surgery could be revised to help move that BMI number down to a lower, healthier category. Second would be type 2 diabetes. So type 2 diabetes in and of itself is a formidable, long-standing, lifelong disease process that needs to be attacked and battled. If the original weight loss surgery put the diabetes in remission, or the diabetes was never an issue but now it's come on later, or if the original surgery just reduced the severity of it but didn't put it completely in remission, all of those are reasons to seriously consider revising the surgery now to more aggressively treat the type 2 diabetes. I say this because there are excellent peer-reviewed papers showing that a revisional bariatric surgical procedure is very successful at further reducing type 2 diabetes and in many cases putting it into a complete remission. Why does that matter? It dramatically lowers your risk of developing the complications of diabetes, retinopathy causing blindness, kidney disease causing kidney failure and going on dialysis, heart attacks, strokes. Those are the big ones, but reducing the risks of all those is huge. So definitely worth considering. And then the third category of reasons I would say is other health problems that are also weight related, and those would include high blood pressure, hyperlipidemia, sleep apnea, bone and joint pains, discomfort in the knees, feet, hips, back, and severe headaches from a condition called pseudotumor cerebri in particular. All of those would be good reasons to seriously consider revising the metabolic surgery to try to make it better, stronger, more effective. I guess lastly I'll throw in a 4th category, which is not very common, and that is if a person was having some side effect related to the original surgery itself. So case in point might be people who have very severe acid reflux problems after a sleeve gastrectomy, or people who are having some problems related to their gastric bypass surgery that might need some surgical attention. So those would be reasons that might consider revising the surgery that don't really have so much to do with treating the underlying problems of excess weight and conditions like diabetes, high blood pressure, etc. But in a nutshell, if you or someone you love is still struggling with excess body weight, and we all know how formidable a problem that is, it is not easy to change our internal biochemistry to lower the set point body weight and budge that number. We can do very little, honestly, with medications, therapy, counseling, diet, exercise. What we really need is to change that internal biochemistry and then work on it with exercise and every tool we have in the book. So if you find yourself years later after a previous gastric bypass or a sleeve procedure, then it may very well be time to consider revising it. Now, the reason it is a good time to consider revising it is that we have never had better solutions than we do today. We have great revision options that generally result in excellent weight loss results and an excellent likelihood of resolving type 2 diabetes and the underlying health problems, and adding years to your life and quality to those years of extra life. So these are the 3 steps I would take if you or a loved one is still battling excess weight. Number 1, calculate your BMI. Is it over 30? Yes, then give it some real thought, do your own research, schedule an appointment with an experienced bariatric surgeon who does revision surgery and has a good track record at it. Not everyone has all those features. Number 2 is take stock of the health conditions that you are battling with or concerned about or run in your family, and see if those fall into the list of things I just mentioned that can be weight related and can be reversed or improved with metabolic surgery. And 3 is to talk it over with your partner, friend, loved ones, but then most importantly with the surgeon who has that skill set that I was describing. And weigh those pros and cons for you as an individual, because no matter what the studies say, this is about you as an individual. I can say that in our hands and in the hands of very skilled, experienced surgeons at great centers around the country, the revision procedure is going to be very safe, very minimally invasive, and very effective. So you have very good options. In many cases, we can also get it successfully covered by people's insurance plans, but not always. So we have a good structure in place to create, pricing to make it possible for people to have it done, even if we can't get the insurance companies to cover it. Much as I think they should cover it, sometimes they don't. So pursue a way to do that with a mechanism that can allow you to get it paid for through cash pay or private funding or financing. So I hope that's been helpful to give you a framework, but as I say, right now we've never had better data, better peer-reviewed literature showing excellent results with the revision options that are available today. And as I say, they should be minimally invasive, safe, and effective. And on the vast majority of cases today, those are true and those are available to you. I hope that's been helpful, and there's some other videos and other materials online that kind of go into more detail about the exact type of surgery that I recommend and that the literature supports, and so you can find that information there as well. All right, I wish you the best of health.